Hi, I'm Ana Norton, a pediatric dentist, and I've studied this topic in depth. Although pacifiers can help soothe babies, their shape, material, and how long they're used can impact their oral health, even before their first tooth appears. The growth of the baby's oral cavity is a crucial aspect of its development, and we should be giving it great importance. Changes to normal development can have consequences that affect all aspects of the child's growth. It is very important to inform parents of the need to monitor their children, ideally with first appointment being made by the age of 6 months and no later than first year. Given that the temporary dentition begins to form during intrauterine life, monitoring the pregnant woman is also very desirable. Tooth eruption begins on average at 6 months of age and is finalized when the children is around 2.5 years old. Throughout this period, there are many aspects that professionals can help families achieve in order to see their baby grow up happy and with a healthy, radiant smile. Although, as a pediatric dentist, I believe that the ideal is for babies not to have any non-nutritive sucking habits, the high percentage of babies who use a pacifier means that, as a child health professional, I have a responsibility to respect and advise families on the choice of pacifier. Naturally, the severity of the consequences of pacifier use depends on the intensity, frequency, and duration of the habit. There are several aspects of the pacifier geometry that in themselves entail a greater or a lesser risk of developing serious oral alterations. It's also important to explain to parents who decide to offer their babies a pacifier that its use can have a favorable effect on certain aspects, such as prevention of sudden infant death syndrome, calming the baby during more invasive medical procedures, and in learning the sucking reflex, which is very important for premature babies. It's up to families to decide whether to give their babies a pacifier, and our role is to advise, inform, and not judge. There are crucial aspects for promoting good oral cavity development, such as nasal breathing, the absence of non-nutritive sucking habits, the correct positioning of the tongue, and the balance of extra and intraoral muscle forces. When a family decides to give their baby a pacifier, we must advise them on its choice. There are so many different types on the market that parents get confused, and we mustn't let the aesthetic factor dictate the choice. For this reason, it is important to study the shape of the pacifier in order to choose the one with shape that will cause the least serious consequences from its use. Intensive pacifier use can lead to several dental misalignment, as well as phonetic alterations and speech problems. To minimize the severity of these consequences, several aspects of the pacifier should be taken into account. The material in which the pacifier is made is important, should be as soft as possible, like human skin, to allow the teeth to collapse against the palate, so that there is minimum space between the two dental arches. As far as the shape of the pacifier nipple is concerned, you need to choose a nipple whose base height is as low as possible. This is very important when consider anterior open bite, the most common malocclusion in children who use a pacifier. Also, you should choose a teeth that allows the tongue to be raised as close as possible to the palate. The correct position of the tongue during sucking is essential for the correct development of the baby's face. The teeth of the pacifier should follow the width of the palate as closely as possible in order to reduce the risk and severity of posterior crossbite, another malocclusion closely related to pacifier use. All these aspects should be considered when buying a pacifier. As a pediatric dentist and given the high prevalence of pacifier use, I felt the need to study this subject in more depth. From clinical observation of my patients, it was clear to me that complications associated with pacifier were not the same for all types of nipples. Studying the scientific literature, it's not easy to find a consensus. Even in studies with the most scientific evidence, like systematic reviews with or without meta-analysis, the results are contradictory. It's easy to see why. The etiology of malocclusion is multifactorial, and it's very difficult to isolate a single cause. So, with essential help of colleagues from the fields of biomedical and polymer engineering, a computational model was created that made it possible to objectively compare the action of different forms of teeth in the oral cavity of a 6-month-old baby. Different teeth shapes were compared: orthodontic, symmetrical, and round, and the impact of the action of the pacifier on the palate and the position of the teeth, including unborn teeth, was assessed. It is very important to note that even teeth that have not yet erupted suffered displacement forces that were greater or lesser depending on the shape of the pacifier tested. In a study where different pacifier geometries were compared under the same test condition, we understood that what our clinical observation suggested was true. The shape of the pacifier teeth, which combine the different aspects mentioned above, the use of a very soft silicone, a small base height, adequate width, an unsymmetrical shape that allows the tongue to be lifted, obtained the best performance in simulation carried out, particularly with regard to the pressure exerted on the palate and tooth displacement. We can say that for the same conditions of use, this teeth carries a lower risk of developing serious malocclusions. If there is a habit of sucking on a pacifier, this is what we want for our babies, that the risk of developing oral and dental alteration is as low as possible. As a pediatric dentist, the results obtained in this study have been extremely important for my daily clinical practice, since I can advise parents even better on the choice of pacifier. In order to minimize the risk of developing malocclusion associated with the use of a pacifier, it should be chosen taking into account certain aspects of its shape, namely, the lower the height of the base, the lower the risk of developing a severe anterior open bite. The closer the pacifier fits to the baby's palate, the more distributed the forces applied to the palate will be. Avoiding smaller but higher pressure areas on the palate reduces the risk of deformity. This aspect is important in preventing maxillary compression, which is one of the etiological factors behind posterior crossbite. The teeth of the pacifier must allow the tongue to move upwards, must collapse against the palate so that the tongue continues to exert its action on it. Combining these three factors can reduce the risk of serious problems in the future. Remember that pacifiers should be used thoughtfully. Pacifiers can support babies during their sleep routines, helping them to calm down. They should generally be introduced in the first few months and gradually decrease in use, ideally up to the age of 2. Because a beautiful smile also starts with the right pacifier, a shape that keeps your child smiling. So choose wisely. Protecting your baby's smile is priceless.